Okay, hi everybody. This is Julian Berryman from from EuropeActive with our latest webinar in our series of EREPS focused webinars. Today's offering will deal with the whole area of exercise during pregnancy and the postnatal period, exercise for two, how to involve pregnant women in exercise sessions. So we'll come to that in just a moment. We have three very eminent speakers today who've done a lot of work in this area. Before we do get started, however, just a few things to mention. First of all, just some admin. If you want to ask a question, you can do so in the Q&A section there. If you just hover over the bottom of your screen, you'll be able to see that. So please ask questions, and I'll try and pose those to our panel at the end. None of you guys are visible, and you can't actually speak, but use the Q&A, please. Just a couple of things to mention about EuropeActive. In terms of our webinars, all of our webinars are recorded. They're all going to be available on our COVID-19 page on our website. Please go there. There's loads of resources for you there, which will be of interest. So please have a look on our website. I'd just like to mention as well that on this Saturday, the 30th, at 5 o'clock Central European time, we're having a Be Active Hour. Now, this is an initiative supported by the European Commission. Clearly, in these troubled times, it's extremely important that people are active, and I think more people are appreciating that fact in terms of immune function, etc. And we and the European Commission would want to support people in that. So we're having a Be Active Hour where we're asking people to be active for that hour. There's lots of stuff going out from EuropeActive on that. We would hope that you as EREPS members would inform your family, friends and clients about the hour and get involved. Again, you can find out more about that on the EREPS and on the EuropeActive website pages. So please have a look at that. Okay, so we need to crack on with our presentation. So I'm going to introduce, we have three speakers today. Each will speak in turn. They've got PowerPoint presentations. As I say, ask your questions. The first of our speakers is a lady called Professor Anna Shumilevich. I work with Anna a lot. She is Deputy Director of the Professional Standards Committee for Standards and has done a lot of work, particularly in the area of pre and postnatal training. Anna works at Gdansk University. I think is Vice Dean there, I think, Anna. But if I can pass over to Anna, Anna's going to kick us off, and then we'll move to a couple of other very eminent professors. Over to you, Anna.
Okay. So thank you very much for your invitation. I'm really happy about this webinar. This is a great moment to share new knowledge on exercise in pregnancy and refute the myths associated with this topic. So in the last 30 years, more and more scientific research proves that exercising during pregnancy leads to numerous health benefits, both for mother and child. Therefore, the approach to so-called prenatal exercise has changed significantly. The 19th century recommendation was to avoid exercising during pregnancy to end it safely. What is our current approach? So already in 2015, so 5 years ago, the American College of Obstetricians and Gynecologists, ACOG, published a breakthrough statement that lack of physical activity in pregnancy is a risky behavior and may lead to many pregnancy complications. So today we have enough evidence to say that inactive pregnant women are more likely to develop non-communicable diseases like overweight, hypertension, diabetes, urinary incontinence, or mental diseases, especially postpartum depression. What's more, their children are also at higher risk of obesity and some metabolic disorders later in life. Okay. So, preparing this presentation, I found a beautiful sentence. Maternal health holds the key which could unlock the door, not only for the well-being of women today, but for future generations. And the question is, why do we have so many myths related to exercise in pregnancy? And one of the reasons is that 40 years ago, we had very conservative recommendations on this topic. They were based, among others, on the results of scientific studies conducted in laboratory animals, which demonstrated some negative effects of hard physical work on the development of pregnancy. But I must underline that these animals performed exhausting physical effort combined with undernutrition. So certainly we don't have such conditions in health-enhancing physical activity in women. Professor Rita Santos Rocha will give you more details about current recommendation and about planning of prenatal exercise. So I will focus on the most common mistakes made by exercise professionals working with pregnant clients. And I will try to dispel some myths. So one of the harmful mistakes is waiting until the end of the first trimester to start exercising. Unfortunately, for the first few weeks after becoming pregnant, many women stop exercising or significantly limit it due to the fear of miscarriage. And obstetricians often wait until the end of 12 or 13 of the 13th weeks of gestation to give their patients permission for exercise. And we know this is true, that the rate of spontaneous abortion is about 10% in the first trimester. And I would really like to say that we can decrease the rate through the exercise, but what we know that there is no difference between exercises and not exercisers in this regard. But what is really important that in the first trimesters already many changes are in the cardiovascular system. So I can say that a pregnant body screams for exercise to stimulate the heart to work faster and pump more blood. We have much more blood in the pregnant body to give the baby enough oxygen and nutrients. Another very dangerous myth is not to exceed the intensity of exercise above 140 heart rate. So I must agree that exercising around 140 will be effective for the majority of pregnant women. However, we need to remember that too low intensity may not be sufficient to stimulate the cardiopulmonary system and not produce the desired health effects, especially for those women who were accustomed to much more intensive exercise before pregnancy. So Canadian experts recommended exercise heart rate ranges, but I underline that they are not heart rate maximal limits. And as you can see, some of these values are much above 140. So as I said, I conduct some research, some scientific and educational project called FemFit at my university, and we tested there over 200 women with various levels of physical activity and exercise capacity, with a progressive test up to refusal. So it was maximal effort, and we observed no adverse outcomes. And based on the test, we established exercise heart rate zones. Again, as you can see, for many women, recommended heart rate values were higher than 140. We asked our study participants to keep their heart rate close to the upper limits to ensure exercise around anaerobic threshold. And it was important to assess how we can use exercise to prevent, among others, gestational diabetes and dyslipidemia. We analyzed level of irisin. Irisin is an exercise-inducible myokine that regulates lipids and glucose metabolism. And we found that more sessions pregnant women performed, the higher was the level of irisin in blood. And what is really interesting, With the increase of irisin, we observe the decrease of glucose and insulin levels. So lowering these blood parameters is the first step to prevent gestational diabetes. In another study, we observed that the post-exercise increase of serum irisin was related with lower levels of total cholesterol in active pregnant women. And this is really amazing that we found this correlation, also significant, but the correlation was inverse in inactive control women. So we can say that the protective irisin-based mechanism doesn't work without exercise. This is a great study by Perlaes et al., confirming how important is sufficient intensity of prenatal exercise. So they subjected pregnant women to a moderate intensity exercise and observed that that in the group of women inactive before a pregnancy, they observed the decrease of risk of pregnancy hypertension, gestational diabetes, fetal macrosomia, and also metabolic disorders and overweight or obesity in their children. However, in the group of women active before pregnancy, these results were not statistically significant. So in my opinion, this is my interpretation, the applied training stimulus was too weak for this study group. And of course, to achieve higher intensity of exercise, sometimes it's necessary to use so-called high impact exercises, including runs or jumps. And here, the next myth can appear that high impact exercises are dangerous for pelvic floor muscles and can lead to urinary incontinence. So in two studies, my colleagues and me analyzed the pelvic floor muscle function with the use of electromyography and with incontinence impact questionnaire. And our results show that women who supplemented their exercise program with proper pelvic floor muscle education and training, they can even improve their pelvic floor function. And the training women, you can see the red color is the control group, the blue color is the experimental group. So they improved both in contracting and relaxing pelvic floor muscles. And what is very important, the key finding was that all of the women, even practicing, performing high impact activities, they maintain their urinary continence. So based on these outcomes, we can recommend such programs for pregnant women. And probably some of you would like to ask, what about the birth outcomes? Does high intensity or high impact exercise lead to premature labor, miscarriage, or labor complication? And now we have enough evidence to say, no, it's not true. So for example, you can see a systematic review from 2017, and this is clear evidence, higher leisure time activity is not associated with reduced risk of premature labor. And another paper from 2019, meta-analysis that included 53,000 pregnant women, and very strong evidence that owing to exercise, we can reduce the rate of instrumental delivery. And for me, this is the last one that I like to underline, that there is no relationship between exercise and diastasis recti, because there is another myth related to exercising abdominals. Still many women and also exercise professionals believe that pregnant women should not exercise abdominals, but what we know today, women during pregnancy should strengthen abdominal and back muscles to minimize the risk of lower back pain. And of course, this is true that there is a risk of separation of the rectus abdominis. This is a common condition which appears from 60 to even 100% women in the third trimesters. But there are crazy beliefs that you should not, for example, perform crunches during pregnancy to prevent diastasis recti abdominis. And there is a study that gives us the proof that crunches are first safe, second that they are effective to to narrow interact distance. And again, the myth that we should not exercise in supine position, that it can be dangerous for the baby. This is true that in this position, the heavy uterus presses on the inferior vena cava, and the blood flow is a little bit disturbed. And some women can feel dizzy, or they can feel discomfort, but it's not true that we should limit all exercises that are performed in this position. And for me, this is the biggest mistake, not to allow women perform the exercises they like. We have also other unfounded ideas that you can have some injury when you perform flexibility exercises, or that you have to reduce the training load significantly, or that you cannot change direction or raise the arms above your heads. But of course, they are, just the opinions transmitted from generation to generation without any rational support. And very dangerous myth that that appears sometimes, actually too often, I can say that to improve the pregnancy outcomes, women are recommended for bed rest, and this is really very, very harmful for them. So today we know that it should not be recommended. Bed rest should not be recommended for pregnant women. What's going on in Poland? This is incredible that 60% of pregnant women doesn't exercise because of the fear of their baby's health. So even if we have so many evidence, they are still afraid to exercise. And here's the place for exercise professionals. They should encourage them, and they should educate them that it's really important to support the development of their babies by exercise. And in 2016, EuropeActive published the first international document. It was Pregnancy and Postnatal Exercise Specialist Standard. And about 25 experts from 14 countries worked to develop this document. It was rather broad, and the education took very long. So therefore, we are changing now it a little bit. We are working on supplementary qualification exercise in pregnancy. And owing to that, the education for fitness instructors and personal trainers will be more accessible, but also very, very effective. I would like to finish my presentation with a short message. Exercise during pregnancy is not a luxury that only the most fit and active women can afford. This is the duty of every future mother to ensure her child develops properly. And exercise professionals should update their knowledge and skills to support pregnant women in this task. Okay, so thank you very much.
Thank you, Anna. Yes, fascinating stuff, exploding some of those myths around training in pregnancy. And thanks for the plug on the exercise and pregnancy standards that we hold. That's good. I hope that motivates some of our professionals to look at courses in this area. Okay, so we need to move on now to have a presentation from Professor Rita Santos Roca. Rita works at the Sports Sciences School of Rio Maior in Portugal. And Rita is going to talk to us now about guidelines, specific guidelines for exercise prescription. We've got a couple of questions come in, but we'll save those to the end if you don't mind. So perhaps now, Rita, if we can ask you to share your screen and give your presentation, that would be helpful. And there you are.
So, is it possible to? Sorry. Okay, now we have the full screen. So thank you very much for the invitation. So I will be speaking about the recommendations and guidelines for exercise testing and prescription during pregnancy, and about the main documents or the main references we have. So we have recommendations for the apparently healthy population and other populations, and we have specific documents with recommendations for the pregnant women. So as my dear colleague Anna Zumilevich has told you, the most common recommendation, the most common paper, the guidelines are from ACOG, and they recently updated that document from 2015, and this document was just updated last month. So the most important recommendation is that pregnant women should practice at least 150 minutes of moderate intensity aerobic activity per week during all periods of pregnancy and postpartum. But this document also states that physical activity and exercise in pregnancy are associated with minimal risks and have been shown to benefit most women. However, we have to modify the routines because of normal adaptations, and also that there should be a clinical evaluation before recommending an exercise program to pregnant women, because pregnant women should be checked for medical or obstetric complication. Well, the normal thing is that everything is normal, but anyway, they should be checked for any possible complications that might appear. And as already mentioned, it is very important that this kind of paper states that activity restriction should be not prescribed routinely as a treatment to reduce preterm birth or other myths that already have been mentioned. Also, that we still need additional research to better understand the effects of exercise, and specifically which is the what is the optimal exercise program. So, but the main update of this document was the adding of more and the updating of more scientific evidence supporting the benefits of exercising during a pregnancy, because exercise and physical activity have several benefits for the general population, as we know, but also it has specific benefits regarding all the adaptations that this particular period of life involves. Other interesting documents are those published in 2016 and 17. These four papers were produced by an international group of researchers, and they were supported by the International Olympic Committee, and these refer to the pregnant athletes. So they are very specific for the pregnant athlete. And what I think that is a main reference is the updated, recent and evidence-based, fully evidence-based guidelines from this group of Canadian researchers supported by the Canadian Society of Exercise Physiology. So in general, and to synthesize the recommendations, so all women without contraindication should be physical active throughout pregnancy, no matter if she is inactive or if she is diagnosed with gestational diabetes or is overweight or have other clinical condition. Again, they should accumulate at least 150 minutes of moderate intensity physical activity, and they should accumulate this exercise over a minimum of 3 days per week, but being active every day is encouraged. So these authors perform several systematic reviews and meta-analyses, including many studies and many pregnant women to support these recommendations, and adding the information about if this evidence is of high quality or low quality. So they also stress that any prenatal exercise program should include a variety of types of exercise: aerobic resistance, neuromotor stretching, and also pelvic floor muscle training. However, we have been analyzing these guidelines and other guidelines published in other countries in other languages, and we have noticed a lack of specific contents on exercise adaptations, because mainly because these guidelines are written by doctors to doctors, and sometimes the exercise professionals neither are properly addressed nor the skills and competencies that they should demonstrate in promoting and delivering the programs are well referred. So we need further studying other documents and other studies and other guidelines, for instance, those from the American College of Sports Medicine, in order to set the plan for exercise testing and prescription. So this leading to the adaptation of the exercise programs. So the exercise professional must follow these steps from the health screening and until the exercise intervention itself. So the first step is the health screening, because we have to know about the stage of the pregnancy, the adaptations, the health conditions, and the physical activity level. So the first step, as I was saying, is the health screening. Health screening, of course, provided by the healthcare providers, in order to make sure that they have medical clearance to be involved in an exercise program. So and after that, the exercise physiologists have plenty of tools for what we call the pre-exercise evaluation, and we also have generic tools to record these issues, and we also have specific tools for this pregnancy period. So as I was saying, in different trimesters of pregnancy, we have to be aware of the different pregnancy-related adaptations in anatomy, physiology, biomechanics, psychology, and the normal pregnancy-related symptoms that will be more prevalent or less prevalent in each of these stages, because this will require verification of the selected exercises and modification of the technique, and which means that we need to increase the supervision of the exercise because of safety reasons, but my colleague Simona will further talk about this. So one very important thing, as the others that I mentioned, is to know the previous physical activity level and experience of the woman. If she is sedentary, if she is active, if she is an athlete, it is a completely different client when I have to plan an exercise prescription and adaptation to of the program. It is very important to understand the motivation of the woman and the goals of the woman regarding this level of physical activity and fitness. The second step would be the fitness testing. And this fitness testing will depend, well, it is also a myth that is harmful. It is not. So, however, it is recommended, an extensive exercise testing process. It is recommended more for medical reasons or research purposes. And because these fitness testing procedures depend on the purposes of the woman and on the expertise of the professional that is going to test the woman. Anyway, we have several basic fitness assessment tools that allows us to better understand the effectiveness of our exercise intervention and to adjust the exercise prescription plan. So next step, the exercise prescription plan. And what we have to know is for each type, we have to make sure that our exercise program includes each type of recommended exercise for pregnant women. And for each type of exercise, we need to know how to monitor the intensity, the duration and frequency, and regarding progression or periodization, we have to be aware of the mostly the stage of pregnancy and what modifications or adaptations are happening with that woman. So this exercise prescription plan must include, of course, aerobic exercise, moderate intensity or vigorous intensity. We need to avoid activities with risk of trauma or fall, but and not really be having these myths about intensity because they can practice moderate intensity or vigorous intensity exercise like any other person. So the recommendations for resistance exercise is to perform multiple submaximal repetitions and ensuring proper technique because mainly of the hormonal adaptations that will interfere with joint movement and coordination. Flexibility is we have the same prescription, the same guideline to the general population, and of course avoiding excessive joint stress to pregnant women like any other client. Neuromotor exercise is related with balance and agility, coordination, and it is included in several regular activities that we have in clubs, and we have to be to ensure proper technique as well, and avoiding positions that cause discomfort or are likely to result in loss of balance and falling. And finally, pelvic floor training. So this is very specific to be included in any prenatal exercise program, and we have to ensure proper technique due to the to verify the effectiveness of this type of training. So finally, we have to answer this question: what forms of exercise are safe and effective? And the answer is most of them. So most forms of exercise that we can deliver in group sessions or personal training sessions it is possible to adapt to the different stages and different conditions of our pregnant women, and also they are related to cultural activities. There are activities that are pretty normal in some countries, and we don't have those safety issues regarding adapting or not this form of exercise. So most forms of exercise are possible to be adapted to be tailored to our pregnant clients. Of course, I have to mention our publication with further reading and to further study about all these issues that I have mentioned. And I have to tell you that we fortunately published this book last year. It is the first international publication with evidence-based guidelines, and totally focused in exercise and sport activities during pregnancy. So I hope this book and this webinar help exercise specialists to get more pregnant women more active, more often, and for sure happier. Thank you very much.
Thank you, Rita. Can everybody hear me? Yes, I think so. Yes, thank you, and thank you for mentioning the book. That was that you've stolen my thunder there. I was about to mention the book as well. So yes, exercise and sporting activity during pregnancy, fantastic, important references. I know when I was looking at this area, there wasn't a lot of material available. American College of Obstetricians and Gynecologists, ACOG, but that was about it. So yeah, great stuff, Rita. Thank you very much. So let's move on to our final speaker, another professor, Professor Simona, and I'm going to struggle with this, Paolini. That's my best attempt. And Simona, again, I've known for many years, a member of the Professional Standards Committee, lecturer at Lithuanian Sports University, co-founder and program director of Active Training, which is one of our accredited, EuropeActive's accredited training providers. Now, Simona is going to talk about specific considerations and some of the safety aspects around working with pregnant women. So over to you, Simona.
Okay, thanks, Julian. And hello, everybody on the other end of my screen. And it's my pleasure to participate in this webinar and give presentation after such fantastic presentation from Anna and Rita. So now it's time to speak about safety, because it was a lot of nice recommendation. I want to tell that every woman should think about this, that there should be minimum injury risk for both, for her and for fetus. And it should be also very comfortable, because especially when pregnancy progress, you can feel a lot of not nice symptoms in your body. So the main message is that pregnant women must be active. It's one message for everyone to bring you away after our webinar, but must be kept clear all these cautions. So exercise form, contraindication, and warning signs to stop exercising. So let's speak a little bit. And I must tell that there is no strong scientific evidence that some sports activities are indeed dangerous for pregnancy or fetal development. As Rita mentioned, so even cross-country skiing seems that very dangerous sport kind, but even me being pregnant, I did it until last week of my delivery, because every woman is different, every pregnancy is different. And we can divide physical activities in such three general groups accordingly ACOG. So the most appropriate and safe for every pregnant woman are these. Safe activities for pregnant women who participated in these activities regularly before pregnancy. And yes, the words not recommended sound not nice, but these activities is like, be aware, be careful. It could damage or make some injuries. But take a look to these photos. Seems that all these women ignore all recommendation because they continue their favorite lovely physical activity, and life didn't stop with pregnancy. So looking to recommendation, we need to look very, very individually. Where is first step? First step always starts from the doctor. It's normal that doctor is boss here. Second step is exercise professional. So prenatal exercise specialists should work with pregnant women only after she receives medical clearance for exercise from her doctor. And PARMED X examination, as Rita mentioned, should be checked by doctors, but exercise professionals should be aware about it. What is this? And once established some limitation for women, an algorithm of future step must be created. And please advise your woman to repeat this test, this examination during whole pregnancy. Because with negative examination means that stop doing your service, because woman needs doctor more than you as a trainer. And what I can tell, in different countries, it's different guidelines. So you can find them easily. I don't want to speak in each very detail, but yes, for sure, absolute contraindication are serious condition for woman and fetus health. But even with this contraindication, it's possible to be active, because being sedentary during whole 9 months can also affect women's health. So it's necessary to move. Speaking about this contraindication, it's very important to understand that personal trainers and group fitness instructors can work only with healthy pregnant women. They have no competences to work with contraindication cases, but highly qualified and certified pregnancy exercise specialist is educated to help this woman also. So it's all about education. Exercise specialist cannot work alone. He must be in a group, and every time in each case, he can refer her client to other different specialists. And here, these are several special considerations that should be taken in account to maximize the effective training program and ensure safety. So let's speak a little about some of them. Yes, we know that during pregnancy, metabolic demands increase, and seems that women can eat more, but she can do that if she stay active. if she stops all activities because she is pregnant, so metabolic demands doesn't increase. Another very important condition is hypoglycemia. So we need to understand that high intensity or prolonged exercise can lead to this condition. So from your side should be advised to take adequate caloric intake before exercise session. I know that this question is very often raised from women because scales are either friends of women or either enemies. But many women, even pregnant, they just don't know how much weight they can gain during pregnancy. And a nice recommendation, very important, that they distributed by pre-pregnancy body mass index. So you as exercise professional can just divide this recommendation. For example, pre-pregnancy normal weight group, you can advise to weight gain from 19 till 16 kilograms. But if you are obese, so recommendation is much less. And the message that women who exercise 3 times and more during pregnancy had a lower risk of gaining excess weight. So exercise is medicine here also. These two conditions are controversial because from one side, pregnant women should drink water before, during, and after exercise. But pregnant women also can experience urinary incontinence during exercise. And here, to minimize these symptoms, trainer can refer to pelvic floor muscle exercise, minimizing a little high impact activities, avoid breath holding, or just simply advise, don't remember to go to the toilet. These activities should be used with caution if woman feels symptoms of dizziness. So isometric contraction, motionless standing, long pauses, for example, in yoga, or fast modification of movement plan, even strong abdominal compression, and exercise in supine position after week 16 of pregnancy. So if women feel dizziness, so take aware, be careful. Hot and humid is not friend of pregnant women, and especially exercising. So please avoid this. If you organizing training for pregnant women, please do that in controlled environment, better in air conditioning setting. Please avoid air pollution and bad smell because pregnant women are quite sensitive for the smell. And also be aware when you're running or cycling, rocky terrains, unstable grounds should be dangerous for pregnant women. Session is the same rules, the same principles as normal session, but here please take much more attention to warm up and cool down, and especially in cool down where you can include breathing exercise and pelvic floor training. These warning signs to stop exercise should be visible in your fitness club or in the wall or on the wall of your studio, or even you can print and give to your participants just to know that if she would feel any of these signs is quite dangerous, please don't do, stop. And like summary, please know your limits because pregnancy is not a good time to train for athletic competition. That's not time. And this question, if we need this exercise professional or why we need this professional, I think it's more rhetorical. But still, we have a lot of trainers around the world, especially in social media. We have a lot of trainers with the name influencer. We have a lot of guidelines, messages from closed mamas, super mamas group. Many of them are old-fashioned, very old and with stereotype thinking. So it's necessary to update and listen through exercise specialists. If you don't believe, so another thing, please ask yourself, are you really competent expert in human anatomy, biochemistry, biomechanics, and physiology? Do you really understand how body is affected by pregnancy and physical load? And how to combine both of them? are you sure you know the problems with your body's functionality? If yes, congratulations, you are expert, but I think every pregnant woman deserves attention, care, and exercise professional near her. Why women stop activities? The most often reason are uncertainty about how to exercise safely, and also, like was mentioned in previous presentation, concern about harming the baby. But here comes exercise professional with a key role in educating women and encouraging them. Please keep exercise. What is exercise supervision in pregnancy? Women need to feel safe and professionally framed. So please identify needs opportunities, ensure proper technique, progression, provide confidence, provide feedback, motivation, and even behavioral strategies for lifestyle. And very important, just safe testing and training environment. And you can do that by group or individual exercise programs. With these slides, I want to show that there is no black or white. Instead of putting the focus on what pregnant women cannot do, it's better to turn attention what women can do. So prenatal fitness is not about that you need to quit all the favorite exercises for 9th month. It's not present. It's about helping body function optimally and supporting body change and prepare your client for giving birth. But majority of exercise professionals present a low level of knowledge about physical activity during pregnancy. So here is also Anna's research. And here this animation is funny, but it's from reality. When to the fitness club is coming, pregnant woman, many trainers, they just trying to run away because honestly, they feel that they lack competency to help such clients. So let's think about how many of our members in health and fitness clubs are women. A lot. How many of them will maintain an exercise program during pregnancy? Depends on your service. How many of them will come back immediately after delivery or 6 months after delivery? And very important last question, how many of exercise specialists in your fitness club are certified and are able to supervise pregnant and postnatal women? So it's well known that there is a lack of well-designed prenatal exercise program in the market. And it's not enough for pregnant women just join general group fitness class. Well-trained and qualified exercise professionals are able to conduct pre and postnatal classes or do personal training. And that can increase participation rate in your club and ensure safety and also effectiveness. And Ana, Rita, and also Maria Perales from Spain, it was 5 years ago, we worked a lot to create the standard for pregnancy and postnatal exercise specialists. And now it's time to share with you all our knowledge and experience. And here is my message from woman to woman, from present mamas or maybe future mamas. Remember that it's normal to gain weight during pregnancy. Accept your body change. Don't fight. Don't try to stay lean and beautiful. And enjoy your pregnancy as fantastic, mystical, unique, and meaningful experience. And you see, we all four here on one picture. And if you want to contact me, here's my contacts. And thank you a lot.
Thank you, Simona. Fantastic. Thank you. Some great messages there and a great picture. I remember that moment very well. Okay, yeah, just as we bring the session to a close, I think we've just got a few questions here, so I'll quickly push out a couple of questions, and please anybody join in to answer. So what have we got? What if a woman has suffered 3 miscarriages? Can she still exercise? So, any thoughts?
So I can start. So yes, I can say she should exercise, because as we told you many times during this webinar, so bed rest and the limitation, the prohibition of exercise is not recommended now. So the evidence shows that we cannot improve the pregnancy outcomes, um, giving the advice for a woman that she should stay in bed through the 9 months or 3 months. So we know that exercise is very helpful to increase fertility. We don't have much evidence on the special periods like implementation. We don't know much evidence on that. But yes, I would say we will recommend exercise, maybe for those who were completely inactive. So I would start with very low intensities and increase it a little bit later. But for those who were active before pregnancy, they should continue. So even if there were some problems with miscarriages, and now no bed rest recommendation anymore.
Yeah, absolutely, absolutely, Anna. What about sport while trying to conceive? Gynecologists mentioning this should be reduced and very low intensity in order to promote ovulation. Interesting. Anybody want to take that one?
Well, some kind of advice, they just we are not quite sure why they exist, and because as we mentioned in our presentations, each recommendation should be evidence-based oriented. So do we have scientific evidence showing this or not? And in this case, we lack of real evidence about what would be the optimal intensity of exercise and how it would influence this fertilization or conceiving period. Regarding bodybuilding, well, bodybuilding, okay, it's a form of exercise, and as a form of exercise, it can be practiced with different intensity regarding the load and the technique. So what is recommended is that pregnant women should avoid heavy loads because we don't have good evidence about the risks of heavy loads in your joints. So we know that it is a period where hormonal changes will happen and will affect all joints. So we need hormones to prepare pelvic floor, pelvic bones to birth, but these hormones will affect unspecifically all joints. So it means that we will be more prone to some kind of injury regarding our ankles, our knees, our back. And for instance, low back pain is a prevalent normal discomfort that will happen during this period with in most women, and it is due to this this hormonal change. So when you think about heavy loads with an exercise or occupational activity, it is logical that we should be very careful when if the woman wants to keep doing these bodybuilding activities or high load activities. But for safety reasons, the recommendation is to decrease this load or this intensity.
Okay, thank you. Thank you for answering the bodybuilding question, Rita. Okay, and there's one just come in here. We're getting more questions coming in. So this is a very relevant one. So we're now referring to the postnatal period. So after delivery, how much time before you come back to activity? So anybody want to pick that one up? How long should women wait before they start to exercise? Again, should they wait?
No, they shouldn't.
No.
I can say no, they shouldn't. So as you can see, we agree with the answer. So women should start as early as they feel all right after the labor and delivery. So of course it depends what was the process of delivery. So of course operative deliveries will be more demanding for women, but if there was the natural birth, so women can go and exercise. Of course they are very tired after that, so they need 1-2 days to rest, but if they want, they are allowed to exercise even during a few days after delivery.
Okay, fantastic. Well, we have got more questions. Sorry, did somebody else want to say something?
I would like to add that there are specific guidelines to plan a postnatal exercise program. So, and we consider these 15 days, 30 days after delivery. We have specific goals regarding the exercise program, and to start recovery and helping the woman with posture, with well, recovering with those anatomical and physiological adaptations that will be some of them will be extended for a few months, but after 1 month she should be able to be back, so as soon as possible, and depending on the level of physical activity that she performed during pregnancy.
Yeah,
but the question
this is the most important, that if a woman exercised till the end of pregnancy and had some strength training, so she will recover very fast. And of course, if she had to limit some exercises and could exercise only with lower intensity, so of course the time to recover will be much longer. So it always depends on the individual condition of a woman.
Can I also add a little bit? You know, our women, they have imagination and little bit stereotype imagination, what they can do, when they can do. And these are coming more from medicine side, more from doctors. So we need like to make balance, because sport science, exercise physiologists, they do a lot of research, studies, things, and just more channel to promote all this, what was mentioned in this webinar, because still more recommendation is coming from doctor, and these are all about don't train, stay at home, it's not a time, and so on and so on. So our webinar is on time.
Okay.
Julian, yes, I'm now off mute.
Because I cannot see anymore the screen, the Zoom screen. I can see only thank you. And you know, I cannot see the last question we had, because I saw something about the prolactin, as I remember.
Yeah,
right?
yes. I can see it. Do you want me to ask that question, Anna?
Yeah, so of course we don't have much evidence about the hormonal changes in exercising during pregnancy, but from the evidence that we have, a good thing to increase the levels of maternal hormones is to remember about visualization, breathing exercises. So sometimes women have very intensive training, and this intensive training can increase catecholamines, which are the hormones that fight again. I can say that they are against the maternal hormones. And we need to remember that after very intensive exercise, we should spend some time on relaxation, thinking about our body and about some maternal tasks. So it's not very well documented, but it works somehow. We don't know how. This is visualization that I can imagine my body works properly. I'm ready to get pregnant and so on. And there are many cases that I can say that this kind of exercise is helpful.
Okay, thank you very much. Yes, well, I get the feeling that the three of you are just getting warmed up here, and we're going to have to stop. But thank you for all your input. I would say to those people, we've got a lot of people still here listening, and I think we've been very privileged today to have the three of you together to talk about this area. You've all done an incredible amount of work here. So thank you for that, and I sincerely hope that this will inspire some of our EUREPS members to look at becoming qualified in this area. The last international standards meeting we had was all about differentiation and specialization in personal training, identifying your niche and working with that niche that you have a passion for, that you can identify with. And this may well be one of those niches. I know a lot of personal trainers who have concentrated and been very successful in this area. So thank you for all your input today. Fantastic. I'm afraid there are a few more questions. We don't have time for them, but I will get those questions forwarded to you if that's okay. And if somebody can come back with an answer, that would be great. We'd like to answer all of the questions that are posed. But thanks for today. Fantastic information. And stay well, stay safe. Thanks to everybody. And don't forget the EUREPS 1 hour of activity, the Be Active Saturday, 5 o'clock Central European Time. Be there.
Of course, we will be there.
Fantastic. Thank you, everybody. Bye-bye.
Bye-bye. Bye.